I'm Shayna Sarosiek, and I treat Waldenström macroglobulinemia as well as other IgM-related disorders and lymphoplasmacytic lymphoma. I think that everyone at Dana-Farber is 100% committed to improving care for cancer patients, and we're really able to offer state-of-the-art care. What I think is really most important about treating a patient with cancer is knowing a lot about them, as much as I can know. And so my approach is really to review the patient's records before I meet them, but then the first thing I want to know when I meet them is what is the personal side of that story. So instead of just the medical side of the story, I want to know how they're feeling, what brought them to us, and what they want to know from us. Waldenström macroglobulinemia is a pretty rare cancer, but despite the fact that it's rare, there have been some pretty incredible advances in the field, and many of them came from this center. And we have clinical trials that are using new therapies that are targeted directly at the cancer cells, so they have less toxicity to the rest of the body, and hopefully will be much more effective for Waldenström's. We have new therapies coming up that are using limited duration therapy instead of using treatment that goes on for an entire lifespan. For me, it's really an honor to take care of patients with cancer, and particularly patients in the Waldenström Center. I really get the opportunity to answer questions and allay their fears and really encourage them and let them know that the field is constantly advancing and we have better and better therapies every day, and that our whole team will remain available to them at all times to be able to answer questions for them and help them along as they go years and years through their diagnosis.